अगर एक woman है जो already obese है and she gets pregnant, is there extra care that needs to be taken?
Has to have obesity and cardiac disease, then that's a worst combination because obesity can lead to various complications in pregnancy. The simplest one being the diabetes, the gestational diabetes, then being hypertension, and all these things, if you know, ultimately they affect. What do they affect? They affect the fetus.
Hi everyone, this is Dr. Mahima Bakshi. Welcome to my show. My today's guest is Dr. Vaibhav Mishra, who's the Director and Head Cardiac Surgery at Max Hospitals, Parparganj, Delhi. He's been trained in cardiac surgery from the Grant Medical College, Mumbai, and has spent about 5 years in Australia and New Zealand before moving to India to serve the people. So, hi sir, welcome to the show.
Thank you so much.
So, we'll be talking a lot about cardiac issues in pregnancy, delivery, post-delivery, menopause, especially considering different stages of a woman's life and how important is it for women to take care of her cardiac health, because ज़्यादातर देखा जाता है अगर हम इंडियन सोसाइटी की बात करें तो लोगों को ऐसा लगता है कि कार्डियक केयर की ज़रूरत मर्दों को ज़्यादा है, औरतों को उतनी नहीं है. बट इफ़ वी लुक एट दी कंडीशंस ऑफ कार्डियक इश्यूज इन विमेन, सो ऐसा नहीं है दैट विमेन डोंट सफ़र. So
Correct. So if I give you a perspective, कुछ सालों पहले तक ऐसा होता था कि for women it was like get a pap smear, get a mammogram, you're fine. You know, and these studies also, large studies also showed that somehow the risk for of having heart disease to women is less than man. But this was erroneous because the studies were so designed that they were not encompassing the females who were at the risk. Now we know that yes, females are protected to a certain extent, but not to the extent which we always thought. Not to the extent they should not be so careful about their health as compared to a male. I mean, they have to be equally careful about their heart and equally proactive in taking care of their heart health as compared to a male counterpart.
Right.
So yes, now the evidence is there that male females, it is about gender equality. So yes, time has proved that even for heart, they are similar. It's not that they have such great deal of protection, which will stop them from getting serious diseases.
Yeah, right.
So I think it's a great initiative.
Thank you so much, sir. So let's talk about the pregnancy aspect first. What are the cardiac issues, in which a mother's life can be at risk if she gets pregnant?
Sure. So if we talk about cardiac diseases that happen in pregnancy, we have to classify them in two categories. One, which are already there and can be worsened by the pregnant state, and the other which develop directly as a result of pregnancy. यानी कि अगर आपके हार्ट में पहले से ही कोई प्रॉब्लम है, भले ही वो कंजेनाइटल हो या बाद में एक्वायर्ड हो, जैसे कि रूमेटिक हार्ट डिजीज, वो वर्सन हो जाएगी प्रेगनेंसी से, क्योंकि आपका ब्लड वॉल्यूम यानी कि शरीर में ब्लड की मात्रा ज़्यादा है. ये मात्रा ज़्यादा एक रिलेटिव टर्म है क्योंकि आपका जो प्लाज्मा लेवल बढ़ जाता है और ये सब होता है बच्चे के सर्कुलेशन को सपोर्ट करने के लिए. सो कोई भी बीमारी अगर पहले है, इट कुड बी कंजेनाइटल जो बाई बर्थ है, या वैल्वुलर डिजीज जो बाद में एक्वायर्ड है, वो वर्सन हो जाएंगे. अब अगर हम उन बीमारियों की बात करें जो डायरेक्टली प्रेगनेंसी से है, ऐसी कम बीमारियां हैं, बट एक जो कि बड़ी कॉमन तो नहीं है लेकिन सबसे खतरनाक है, एंड दैट कैन हैव अ डिजास्टर्स कॉन्सिक्वेंस ऑन बोथ द लाइफ ऑफ मदर एंड बेबी, एंड द कॉज इज नॉट नोन, इज postpartum or peripartum cardiomyopathy. So when we talk about cardiomyopathy, it is the involvement of muscles of the heart where if you know, heart is just like a pump. So, and there are muscles in it. In this condition, what happens is due to various reasons, the heart becomes weak. It stops pumping the blood or it reduces the function. And when we say peripartum cardiomyopathy, it can occur anytime between 28 weeks to 6 weeks after birth.
Okay.
Many places, many clinicians are not able to pick up because the symptoms overlap with so many things. Edema is there as a normal pregnancy also. Edema is there in post-operative state also as a consequence of anemia or so many things. So often, one needs a very, very astute clinician or somebody who's already aware of this, that there's an entity called this, to be able to investigate the cardiac angle also. So uh, this cardiomyopathy can have a disastrous impact on not just the life of the baby but on the mother also. It has got very high mortality rate because the heart function really goes down. And when we talk about the treatment remains only medical, but then there are a lot of medications which cannot be given to during pregnancy because they will cross the barrier, affect the fetus. So the treatment options also remain limited. Essentially, there are very few medications which will impart any benefit in this condition, and then you have to tide over the crisis. The other aspect is that it can occur after pregnancy also. So most of the other diseases, if we talk about cardiac disease or many other diseases, they are better as soon as the baby is out. Whether it is gestational hypertension or diabetes or many other cardiac diseases, they are better as soon as the baby is out. The disease is better, and that is because that amount of blood going to the heart is reduced by the exit of placenta and other things. So the blood volume comes back to normal, and so the diseases are better. But this is the only condition which can happen after childbirth also. It can start afresh. So cardiomyopathy, as it is, also is a dangerous term because there's not much treatment to it. There's not much surgical treatment. It's basically medications, and here it is directly the result of pregnancy. Why this happens, no one knows. It is still idiopathic, or the cause is not known.
Right.
So yeah, these this is a short overview of what all diseases can happen in pregnancy.
Right. So, and if we talk about pre-existing cardiac diseases, if a woman has these XYZ existing diseases, under which condition she should strictly not go for a pregnancy, be it
Sure.
IVF or a planned pregnancy, and as a matter of fact she might require to go for a surrogacy. वो cardiac conditions कौन सी होंगी जिसमें pregnancy plan करनी ही नहीं चाहिए?
Sure. So, as we know, if somebody ignores their symptoms, they will never be diagnosed of cardiac disease and they can end up getting pregnant. There are a few set of pre-existing conditions or cardiac problems in which pregnancy would be a great deal of challenge and pose a lot of risk to the mother. And one of them is congenital heart diseases. So diseases which are acquired from birth. They are present since birth, but either they have not been manifested, they have not been symptomatic, or people have ignored the symptom. Especially cyanotic heart disease. तो अगर आप सुनते होंगे वो बच्चे जो नीले पड़ जाते हैं बचपन से, एंड कई बार ऐसा ना वो इग्नोर हो जाता है, पिकअप नहीं होता है, एंड दे रीच देयर अडल्टहुड एज ए नॉर्मल पीपल, दे गेट मैरिड, दे हैव फैमिली, एंड ये पिकअप प्रेगनेंसी के टाइम पे होता है, रेयरली. बट बहुत सारे केसेस में ये अडल्टहुड में लाइक 18-20 साल के में पता चल जाता है. सो साइनोटिक कंजेनाइटल हार्ट डिजीजेस, जिसको ब्लू बेबी, टॉफ, बहुत सारी बीमारियां हैं. साइनोटिक कंजेनाइटल हार्ट डिजीज इज स्ट्रिक्ट नो फॉर प्रेगनेंसी. दे शुड नॉट थिंक ऑफ गेटिंग प्रेग्नेंट. Rest all can be managed, but then any congenital heart disease should be evaluated by a cardiologist, should determine the severity of the disease, what stage it is, and then based on that, proper counseling of the family, proper counseling of the expected complications that can happen should be done before somebody embarks on this journey. Right. But yes, congenital heart diseases, strict no. About other cardiac disease, as I said, mitral stenosis is one disease जिसमें कि हार्ट का वाल्व नैरो हो जाता है. सो ये कंडीशन में सबसे ज़्यादा सिम्टम्स होते हैं. इट इज़ पुअरली टॉलरेटेड. तो इस कंडीशन को एड्रेस करना ज़रूरी है. सो एज आई सेड, काउंसलिंग बिफोर, एडवाइस ऑफ अ कार्डियोलॉजिस्ट, and then to determine the stage of the disease and possible intervention. Now the intervention जरूरी नहीं है कि आपको ऑपरेशन करके वाल्व चेंज करना पड़े, but there are therapies available कि catheter based therapies जो femoral artery से जाते हैं, वाल्व को फुला देते हैं. It is called as BMV, balloon mitral valvotomy. So something like short surgery or a non-invasive procedure, but this will provide enough relief for them to successfully take the pregnancy through.
I would also like to ask you about obesity. अगर एक woman है जो already obese है, let's say suppose she is between 80 to 100 kilos and she gets pregnant, so अगर obesity उसको already है तो क्या उसकी वो pregnancy उसके लिए in terms of cardiac issues, क्या it can cause more cardiac problems in her pregnancy? Is there extra care that needs to be taken?
Obesity can lead to various complications in pregnancy, the simplest one being the diabetes. the gestational diabetes, then being hypertension, and all these things, if you know, ultimately they affect, what do they affect? They affect the fetus. Even if the mother is able to, you know, be okay on medications, but all the antihypertensive and everything will affect the fetus. And IUGR, you must have heard, you know, growth retardation, and all these things happen. So ultimately, the baby bears the brunt. So obesity is a very challenging thing. I think everybody, you know, they should have this resolve that if they want healthy and fit babies, you know,
I think they should try to lose
they
some
should try to
weight
lose some
before
weight.
planning a
Absolutely,
pregnancy.
absolutely. I
No?
think it is incumbent
Yeah.
on the parents, and I'm saying parents, not just mother. I think it is incumbent on parents to be in the best of health before they plan to procreate and, you know, bring a new life into this world, because ultimately what you're passing on is diseases. And obese mothers, babies are more prone to cardiac disease also. You know, there are so many cardiac diseases which are common in obese mothers, babies, you know, including hypertension, diabetes, not just metabolic diseases, but so many other diseases. So I feel it is the responsibility of both the parents, you know, to be in the best and fit state before they go on to expand the already populous world.
So also let's talk about the vascular conditions. Now we've talked about gestational diabetes and pre-existing cardiac issues. But what are the common vascular issues that can occur during pregnancy or post-delivery, and which can obviously lead to a bad impact on the mother's health and cause a lot of difficulty for her?
Yeah. So when we talk about the vascular things, they are basically related to veins of the leg. Two conditions which are very common during pregnancy. One is varicose veins, and other is deep vein thrombosis. Now, varicose vein is not a very life-threatening problem. It just leads to a bad appearance of the legs.
And a lot of pain, because I've seen a lot of
Yeah,
pregnant
it does,
women
it does.
complaining of night cramps and a
Yeah.
lot of pain in the calf area, because of which they can't even sleep at night.
Yeah. So it does lead to all those cramps and aches in the leg. Why these varicose vein happen during pregnancy? It's all related to the hormonal imbalances. There are hormones which relaxes the blood vessels, and also there's the weight of the gravid uterus. All these combined, it's multifactorial, and often it is said that the real mechanism is not known. But all these multifactorial etiologies lead to vein being dilated. And so when the vein is dilated, what happens is blood which is supposed to return to the heart gets stagnated there, यानी कि blood वहाँ पे रुक जाता है. वो जो रुका हुआ blood veins में होता है, it causes the throbbing pain. So the treatment remains simple: stockings, venous compression stockings. If you start wearing stockings in daytime, nighttime the blood goes towards the heart by gravity. Daytime mein you wear stockings and the pain and all will go away, but you can still rely on simple painkillers like paracetamol to get rid of it. But stocking remains the treatment for this. They are hard to wear, but they give perfect results.
But it's safe to wear in pregnancy.
It is safe to wear. Okay. The other thing which we are talking about is deep vein thrombosis. Now, deep vein thrombosis can be life-threatening problem also. Deep vein thrombosis, essentially, when we talk about varicose vein, these are the superficial veins. So the veins which are seen from outside. So if you imagine your hand, the veins which are seen from outside, these are superficial veins. And then the deeper veins are not seen. So those deeper veins are much more important for returning the blood to the heart. When there's a clot in those deep veins, that is a problematic situation, because that clot, the deep veins are directly connected to heart. The superficial veins are not. ये deep veins directly heart से connected होती हैं via internal vena cava, IVC, inferior vena cava, IVC. So the clot can dislodge and go to the right side of heart and pulmonary circulation, condition known as pulmonary embolism, causing sudden breathlessness. बैठे बैठे आपकी सांस इतनी फूलने लगती है जैसे कि आप एक्सरसाइज करके आए हैं. तो अगर ऐसा कुछ होता है, that's a serious problem. So DVT, how to diagnose DVT is very easy. You know, not just the pain, but if your calf becomes tense,
hard.
अगर आपका जो काफ है, यानी कि जो पिंडलियां ये अगर कड़ी हो जाती हैं और साथ में बहुत दर्द है, तो मतलब ये DVT हो सकता है. Then you need to go to a doctor, get a Doppler scan, that will be diagnosed, and then the treatment remains in form of medications. But essentially, pain in the legs is okay, but pain in the legs should not be accompanied by hardness. That can be that is a diagnostic sign.
If you look at the entire process of IVF, there are definitely changes in the hormonal stability over there also. क्या IVF का भी कहीं ना कहीं एक cardiac status पे impact आ सकता है?
So if we talk about IVF related consequences और IVF related complications, तो ऐसे कोई direct complications नहीं है, but अगर हम बात करें तो pregnancy induced hypertension जो होता है, again it is a difficult thing to manage. Gestational hypertension जिसको कहते हैं, और diabetes, gestational diabetes, ये दोनों ही IVF mothers पे ज़्यादा common है. So there is a clear cut data showing that people who have IVF have increased incidence of gestational diabetes and gestational hypertension. और इससे एसोसिएटेड जो कॉम्प्लिकेशंस हैं जैसे कि प्रीमेच्योरिटी, लो बर्थ वेट एंड ऑल, वो अपने आप फिर इंक्लूड हो जाते हैं. सो ऑटोमेटिकली विद दीज थिंग्स द बेबीज आर प्रोन टू दिस. नाउ not directly, but something like ovarian hyperstimulation syndrome where it affects every system. The ovaries are hyperstimulated, they release a certain substance, inflammatory substance, which leads to leaky capillaries, and the fluid leaks out of all the capillaries, leading to ascites, जिसे कहते हैं पेट में पानी भरना, pleural effusions and all these. So it can be potentially life-threatening problem. So IVF directly will not impact cardiac status, but other associated problems like hypertension, diabetes are definitely there, especially people who have repeated IVFs or other cycles of IVF. उनमें ये incidence थोड़ा सा और बढ़ जाता है.
क्योंकि also, sir, there are a lot of people who plan to get pregnant in their 40s. If we see the average age in today's time, wherein there are couples who probably go through divorces, or there are women who decide to get married late or have a child after a couple of years of marriage. So if a woman is planning to go for a pregnancy in her 40s, would there be any higher chances of her to undergo cardiac issues during the pregnancy? Is it safe? What's your take on that?
That's a very complicated question, but yes, the simple answer is and we know this, I mean, from beginning, that if the age of the mother is higher and it is in 40s, then the babies are at risk, the mother is at risk for everything, because obviously you're running out of time, and as your tissues age, as your body ages, as your heart ages, your lung ages, your chances of getting diseases are more.
But suppose she's taken an egg donor and she's getting pregnant at the age of 40, then will that age make a difference to the mother's health?
That will make some difference, at least in terms that you've aged. I mean, your tissues have aged, your heart has aged. Now you have higher risk of hypertension, diabetes, other problems. So with 40, I think age of 40 is a big benchmark where your body starts showing signs of aging if you don't keep yourself healthy. So your risk of getting all those diseases and your immunity and your latency to deal with everything is reduced. So I think as a secondary impact,
so maybe it puts the mother at a higher risk of getting cardiac issues in pregnancy.
Yes, at least hypertension and diabetes. Yes, the simple things like hypertension and diabetes.
And would there be a proper cardiac screening process that you would advise for women who want to go in for IVF or plan a pregnancy at a later age? Would there be any sort of a cardiac screening that must be done?
Yeah, I think, as I said earlier, hitherto it was just thought that cardiac women are protected. Now that is true to a certain extent. Till the age of menopause, the hormonal influences protects you. But with now the data which has emerged has shown some amount of risk to females. So anybody if you're thinking of getting pregnant, which is a big thing, and you're also responsible for the safety of your baby, and if you're on the higher side of age, or if you're hypertensive and diabetic already, or you have family history of hypertension and diabetes, then I think it would be very prudent to get a basic cardiac checkup done, and it doesn't take more. All you have to get done is echo. An echocardiography of the heart, which looks at your heart and just tells you that all your heart is structurally normal, all the valves are normal, the heart function is normal. It doesn't hurt. I mean, even if somebody tells you, somebody tells you heart is normal, I mean, you're happy. At the end of the day, you're assured.
Good news.
You're assured that you're fine, and you're assured that your baby is going to be fine. So I don't think getting a simple echo will hurt. There are no guidelines as of now, if we talk about, but
there's no harm.
There's no harm. I mean, how are guidelines made? They're either made by specialized committees, or they are made here, like in these informal chat and talk shows.
Yeah.
And
Yeah.
so there is no guideline, but I would recommend anybody who's more than 35,
Yeah.
who has a family history of hypertension or diabetes, or already has hypertension diabetes, you get an echo before they plan to get pregnant.
Right. I think
Why not?
that's a good take. That in case you're planning for an IVF or you're planning to get pregnant and you've just crossed 35, there's no harm in just getting a cardiac screening done before you plan for a pregnancy.
And also, I would like to emphasize. I mean, I would like to share this. Many times, I have, we see that the incidence of congenital heart disease is
Yeah.
decreasing, and that is because of the early diagnosis and
Yeah.
all that. But even nowadays, there is in our country, there's not much awareness about the fetal echo. So fetal echo is something which can diagnose major cardiac malformations which are incompatible with life
Yes.
at very early age, 18 to 22 weeks of pregnancy, so that if your fetus has such a problem, then you can choose to terminate the pregnancy.
Right.
Then so fetal echo nowadays, let me tell you, fetal echo is so accurate that it can look into your baby's heart from your womb, and it can tell you how good the heart is. It will tell you about all the chambers, it will tell whether the heart functioning is normal, it will tell everything, it will tell about complete heart connections and everything, whatever a cardiologist or cardiac surgeon wants to know, it can tell you everything. So if there's such a revolutionary technique available to find the status of your baby's heart, then it's better to get it done.
Absolutely.
And there should not be any excuse of not getting it done.
No
because
compromise in
even
that.
if one case
Yeah.
happens like that, it is picked up at the right stage and the right measures are taken, then it will save so much, not just for the family but the whole community and the country. Because being born with such heart conditions which are serious then has potential implications, financial, social, every implication. The babies have to be subjected to operations, and then operations only provide a temporary life to these babies. They can never have a normal course as compared to a normal child with a normal heart. So yeah, one needs to be aware of that and take appropriate steps.
Absolutely. So I think a message for all the viewers out there would be that if you are pregnant or if you know somebody else who's pregnant, please make sure कि आप जो fetal cardio echo है वो ज़रूर कराएं, उसको मिस ना करें, because that one test can help you in detecting any cardiac abnormalities in your baby at the right time and help in preventing a lot of cardiac challenges in the baby at the time of birth, which is also advisable by Dr. Vaibhav. So, sir, my next question for you would be, now we'll talk about menopause because we are talking about women through different stages of life. So, जैसे ही एक menopausal stage आता है, बहुत बार ऐसा होता है कि women think कि menopausal stage है, which means I can't work out too much or I cannot exercise that much, and definitely कहीं ना कहीं वो hormonal changes की वजह से mood swings भी रहते हैं और उससे कई बारी some women don't even feel that enthusiastic about fitness. ऑल्सो हाल ही में हमने देखा था कि सुष्मिता सेन का कार्डियक हेल्थ इशू की वजह से शी हैड टू अंडरगो अ सर्जरी एंड शी वाज अगेन वन एग्जांपल इवन दो शी वाज क्रेजी अबाउट फिटनेस. सो मेनोपॉजल स्टेज में क्या कार्डियक कॉमन इश्यूज हैं जो विमेन में हो सकते हैं एंड किस तरह से वो उनको प्रिवेंट कर सकते हैं?
Okay, yeah. So I think that's a good question. So first of all, the viewers need to understand why a female is or was considered protected against cardiac disease up till menopause. So the hormones, the estrogen is a hormone which has a favorable effect on lipid profile. यानी कि आपकी lipid profile पे इसका असर बहुत अच्छा होता है. It prevents the bad cholesterol from rising, and also it has a protective function on the blood vessels. Both this combination led to the fact that you were protected against heart attack till your menopause. And I think nature designed this so that females can have, in the reproductive age, a better life and be free of disease and complications. And as soon as the menopause happens, these hormone level goes down and your risk pretty much approaches that of a man. So with this thing, it is important to understand that your cardiac risk, you cannot wait for menopause to do all those things. which are protective for your heart, like you said, exercise and everything. So it is very important for female to be physically active, exercise, look after their heart health, look after their diet, avoid a sedentary lifestyle, do not smoke, avoid drinking. All those things have to be started way ahead. So whenever we talk about anything protective, it is just like, our saving bank account. You put small money in it
over a period of years.
and over the period of time you have some money. You put 10 rupees in it, after 10 years only you'll see something.
Yeah.
If you see it in 1 year time, you'll have nothing.
Yes.
So when you start exercising from 35, you'll have nothing for 1 year, 2 year. But by the age of 45, you will have enough strength in your muscles, in your bones, to counteract the effect of menopause, which comes in multiple ways. It comes in multiple ways. It decalcifies your bones, it weakens your bones. So we cannot stop that, but we can strengthen our muscles.
Yeah.
It increases the risk of you getting hypertension and all that. But if you're exercising, now what exercising basically does is, how exercising is protective? People ask me that. So it's very simple to understand. When you exercise, the blood flow through your blood vessels increases, the heart pumps more blood, and what this causes is that it causes the blood vessels to expand temporarily to accommodate more blood. So वो लचीले हो जाते हैं, they become flexible. Whereas if you don't exercise, over the period of time, the blood vessels have a tendency to get hardened. That process is called as atherosclerosis. Hypertension is nothing but the increased blood pressure because of the hardness of the blood vessels. If you keep exercising, smoking does the same thing. It causes the blood vessels to constrict, and repeated constriction will induce atherosclerosis and hypertension. But if you exercise, वो आपके blood vessels ना expand होते हैं to accommodate the more blood flow, and they become more elastic. But all this has to be done for 10 years. So for people who think that if they can start exercising in 45 and get rid of the menopausal symptoms, or it's a good step, better late than never. But if you want to reap the right benefit, it has to be started earlier. You said about Sushmita Sen getting a heart stent and all that. So again, we say, coronary artery disease, atherosclerosis does not follow one pattern. It is multifactorial. It just doesn't mean males are more prone to get it, but doesn't mean that females will not get it. People who have more cholesterol, hyperlipemias, various syndromes are more prone to get it, but even if you have normal cholesterol, you can get it. Okay? There are conventional risk factors. Age, hypertension, diabetes, hyperlipemia, sedentary lifestyle. मेरे पास बहुत सारे ऐसे पेशेंट आते हैं जो मुझे बोलते हैं कि सर हमने कुछ भी नहीं किया अपनी लाइफ में और हम एक्सरसाइज भी करते थे, फिर भी हमें हो गया. Then I give them this example. Look, this is like drinking and driving. You say don't drink and drive, you'll meet an accident. But somebody who meets an accident cannot say I was not drunk. Because there are so many other factors that can contribute to it. There are other drivers who can contribute to it. It's the same thing. You take care of your heart, you do everything right, you have all the metabolic profile normal, but you can still get a heart disease. What it means that you will at least have the confidence that you did the right thing. Plus your body will be in a better state to handle whatever eventuality that may happen. It may require a stent, or it may require a bypass or medical management. But your body, if you are fit, your body is in a better state to contain the damage. So all this is multifactorial. Even I think she was the fittest female and she used to do so much exercise. Yet it says that just by doing one thing, exercise, you cannot say that you will. Before that, I think it is absolutely impossible to predict it कि किसको होगा, because I have operated on marathon runners also.
Okay.
Who were running marathons regularly, and when I say marathon, 42 kilometers, which means training for so many days every year to run it. So it doesn't follow any fit pattern. All we can say is conventional knowledge says exercise, do not smoke, do not drink, get regular blood checkups, see your doctors repeatedly, and that should help.
Right. And if we talk about the latest trends, in the techniques being used for the cardiac surgeries in women, is there anything that you would like to share?
Yes, that is my favorite topic. So I would like to tell all my viewers that, there was a time when cardiac surgery was only done by sternotomy. When I say sternotomy, means the division of the breastbone in the center, and used to get a big cut from here to here. But nowadays it is possible, and it's called as minimal invasive cardiac surgery, is to get a small cut, this 4 to 5 centimeter cut here under the breast. So with that cut, what happens is that because that cut is under the breast, it's just this, and there's no division of bone. So cosmetically, it is very good, and also because it's not just cosmesis, but because there's no division of bone, so the pain is less, the blood loss is less, the infection rate is less, your mobilization is early. You are able to practically go from hospital to home on day 3, day 4 post surgery, and able to resume your duties or work as soon as possible, because the precautions of traditional cardiac surgery are not there, like wearing a binder, not lifting heavy weight, not sleeping on the side. All those things are not there because it's from the cut on the side. So I think that's a recent advancement which has happened, and it's happening here at Max Healthcare. I'm doing it, and you can share some pictures. So obviously, if anybody needs it, we are there to help you.
Great. So, any final takeaway message for the audience, for our viewers?
Yeah, I mean, first of all, I want to congratulate you for picking up this topic of heart health in women, because it is the heart health in women is often ignored, and it was just out of ignorance, or the data previously said that female are protected, but now we know.
So, sir, thank you so much for sparing time.
Thank you so much, Dr. Mahima, for giving this opportunity. And I think the topic which you have touched is often ignored, especially in Indian female. And I congratulate you for this awareness campaign and raising this topic here on your podcast. And as a final message, I'd like to say that, ladies, your heart is as prone to heart attack as it is to heartbreaks. So take care of your heart health.
Thank you so much, sir. Thanks
Thank
a lot.